Picture this. You are playing with your little one, and suddenly they reach up and start tugging at their ear. Your heart might do a little flip-flop as you wonder if something is wrong. It is a common scene in many households, and for good reason. Ear pulling is quite common for infants and toddlers. While it can sometimes be a sign of discomfort or a health issue, it is also a normal developmental behavior. It usually occurs most frequently between 6 months and 2 years of age as children explore their bodies and react to various sensations. The primary reason children pull their ears can range from a true medical concern to simple self-soothing. One of the most frequently thought of causes is an ear infection, known medically as otitis media. When a child has an ear infection, fluid builds up behind the eardrum, causing pressure and pain. The child might pull or rub their ear in an attempt to alleviate this uncomfortable sensation. It is their way of communicating that something is not right in that area. Another common culprit is teething. As new teeth emerge, the gums can become sore and inflamed. Because nerves in the jaw and ear are closely connected, the pain from teething can radiate to the ear, leading to ear pulling as a form of relief. Beyond infections and teething, children may pull their ears for less concerning reasons. They might simply be exploring their body, a normal part of development as they discover different textures and sensations. Fatigue or tiredness can also lead to ear pulling, often as a self-soothing mechanism before falling asleep. Sometimes, a child might just have dry skin or an itch inside or around the ear, causing them to tug at it. Furthermore, changes in air pressure, such as during a flight or when going up or down a mountain, can cause temporary ear discomfort that leads to pulling. When you notice your child pulling their ear, the best first step is to observe them closely for other accompanying symptoms. Look for signs like fever, irritability, difficulty sleeping, unusual fussiness, or changes in appetite. If your child seems otherwise happy and does not have a fever, the ear pulling might be due to teething or simple exploration. Gently check their ear for any visible redness, discharge, or a rash around the area. You can also gently press on the small flap in front of the ear to see if they react with increased pain, which could indicate an infection. Understanding the subtle differences in ear pulling can be very insightful. For example, a child might rub their ear more frequently when tired or exploring. However, persistent or intense pulling, especially when accompanied by crying, a fever, or a recent cold, strongly suggests an underlying issue like an ear infection. Pediatricians often look for a red, bulging eardrum when diagnosing an ear infection, which is a sign of inflammation and fluid behind the drum. By understanding the various reasons behind ear pulling, you are better equipped to interpret your child's signals. This knowledge empowers you to differentiate between a routine developmental phase and a symptom requiring medical attention. Whether it is a sign of a looming ear infection, the discomfort of teething, or just simple curiosity, knowing what to look for helps you provide the best care for your little one with confidence.